I am Dr. Anmol Singh Rai. I am a neurologist at Shriman Hospital, Jalandhar. Today I'll be talking about scissors and status epilepticus. How to recognize an emergency in epilepsy and scissors. First, we need to understand what is scissor and what is epilepsy. An epilepsy is a condition in which a patient or a person has a tendency to have repeated episodes of scissors. And what are scissors? Scissors is an abnormal brain activity leading to abnormal body function, which may present in the form of shaking of the body, shaking of the limbs, movement of the neck, turning of the face, or simply in alteration of consciousness which lasts for a few seconds. There are two types of scissors. One are convulsive scissors and other are non-convulsive scissors. Convulsive scissors everyone can identify with the patient having shaking of limbs, frothing from the mouth, unconscious, patient falls down. The difficult ones to identify are the non-convulsive scissors, which do not manifest in such a way. They may just manifest in the form of some lip smacking, patient looking or staring towards one side for a few seconds. So these scissors are very important to identify. Not every scissor is an emergency. When is a scissor an emergency, we need to understand. Firstly, whenever a scissor, it lasts for more than 5 minutes, it is always an emergency. Or there are recurrent scissors, various scissors without the person regaining consciousness in between those episodes of scissors. So if a single scissor lasting more than 5 minutes or recurrent scissors without the person gaining consciousness in between, then it is an emergency. So what should you do if you have a person in front of you having a scissor? Firstly, you need to identify whether it is a scissor. So anyone unconscious, moving his limbs, frothing from the mouth, consider it to be a scissor. You don't have to panic and you don't have to let others panic. First thing you can do is to put the patient on his or her side so that the secretions may be cleared and the tongue does not fall down. You just clear the patient of any tight clothes or any tie around the neck. Let the patient breathe on his or her own and just stay with the patient so that he or she does not have any injury from side. Just stay with the patient for a few minutes and the scissor will be gone. The patient may become conscious or semi-conscious after that, and then you can seek the medical help. So it is not an emergency always to rush the patient to the hospital. When you have time, the first few minutes you have to manage on your own. And if 90% of the scissors, they stop within a few minutes, if it doesn't stop, only then rush to the hospital. Secondly, there are many myths about scissors in our society. We have all seen whenever a patient has scissor, all the people, they rush towards him or her. Someone puts water into the mouth. We should not do that because it has a risk of going into the windpipe. Secondly, the people, they try to put various things in the mouth like a spoon or something which could be injurious. These things should not be done. Epilepsy and scissors are a treatable and a preventable condition. We must not get into these myths. We must get the treatment at the earliest from a qualified neurologist, and we must not panic on seeing a patient having a scissor. Thank you.